Thank you, Mr. Chairman. Look, I care passionately about this subject. I want to put a couple things out. I'm actually a fan of managed care, as long as the incentives are designed for those of us who sort of grew up in the early literature from the late 70s, early 80s, that managed care was going to be a model where the incentive is, as an organization, we benefit by helping people become healthier. In an age of technology, miracle drugs, the abilities now to help people with their BMIs and other things, I will argue that if we read through the MedPAC reports from the last decade, the incentives are misaligned. That's all in many ways my legislation, this, help us. And there's some points I want to make. This is one of the reports, we often call it the beneficiary to worker ratios. Please understand from a global standpoint, this is more for all the members sitting here on this committee. In 7 years, the Medicare Part A trust fund is empty. We actually have an issue where in just a few years, I have less than 2.5 workers per Medicare beneficiary. It's demographics, it's math. It has also become public that oversight has actually been doing inquiries for months. I want to thank, for particularly if there's representatives here, a number of the MA companies have been remarkably open in helping us understand their distribution models, how they work, how they score. A couple have been a little crankier, but we have maybe tens of thousands of pages that we're running through our data systems and those things, trying to document. And Mr. Chairman, when it hits the right moment, I am going to submit a whole series of articles from the Wall Street Journal series to, I think there's a ProPublica article, some others in here, which document where maybe they weren't the MA provider itself, a contractor, but individuals who have been risk scored with diseases they don't have. And if the MedPAC report is correct, and I know there's some controversy in the scoring, but even when we've done distributional, taking just those in fee-for-service, stripping out those who just choose to just take the hospital portion and adjust for cost, if you look at the last decade of MA reports, MedPAC reports, you have 15 to 20 and some reports that may be even slightly higher. Just multiply that cost over fee-for-service, and then the fact that our promise, particularly those of us as Republicans, who are substantially responsible for this design, when this came into effect in 2005, Medicare Part C, it was going to come in at 95% of fee-for-service. If our culture really is the moment where we understand the power to society of having a healthier society, can we work with the insurers, work with CMS, work with MedPAC, work with my Democrat brothers and sisters, my Republican brothers and sisters, get the incentives aligned? Because as I mentioned before, our baseline obligation looks like it's $16 trillion over the next 10 years. This isn't a game. This is one of the biggest things in our government. Let's get this right. And with that, I yield back, Mr. Chairman.